Welcome to Business Leadership Podcast. In this podcast, I interview successful business leaders and industry experts to help you grow your business. In this episode, I had a very interesting discussion with Rich Palarea, CEO and co-founder at Kermit. Kermit is a Baltimore-based healthcare cost reduction and spend management company, bringing automation and insight to the high-spend category of implantable medical devices within a hospital and healthcare. He's also a host of Healing the Hospital podcast. We had a very interesting discussion around various business challenges and opportunities when you're trying to grow a company. Rich shared insights on what are the key problems to solve in a market and how do they solve it and how to scale a company in the healthcare industry. If you're in a business leadership position or a business owner in any SaaS-based business or any technology-related business or just simply product and services business, you don't want to miss this discussion. This was a CEO's perspective on how to identify the problem, how to solve the problem, and how to scale a company when you solve the problem in different geographical areas. He also talks about some of the key challenges he's up against, how to approach that problem, how to approach the change management in the healthcare industry, and how to deal with those challenges. I'm hoping you will take away something from this discussion that will apply to your business, and it will help you solve some of the key problems you're trying to solve for your clients as well. If you find a value in this discussion, don't forget to like, subscribe, send me your feedback. Until next time, enjoy this discussion. Hi guys, welcome to Business Leadership Podcast. Today my guest is Rich Palarea, right? Is it Palarea, Rich? Have I pronounced it right?
Palarea.
You're from Kermit. And definitely technology and business, they match always together. I'm looking forward to a discussion, learning from you, looking forward to a discussion, chatting about technology and a business. Thank you so much for your time. Welcome to the podcast.
Yeah, Gurmeet, it's my pleasure. Thanks for having me today.
Yeah, welcome. So if you walk us through what Kermit's about, what do you guys do and how long you guys been around?
Sure. So we are a technology-enabled service. That's just a fancy way of saying that we're a consulting company that uses technology to be able to deliver our services, which are cost reduction and spend management inside of hospitals in the United States. In a very particular area, we're in the operating room. So any device that is implanted into the body, we negotiate better prices for those devices, such as knee implants, hip implants, spine, cardiovascular, 28 different categories. And then what we do is we've digitized the entire billing process with a piece of software. We can describe to you how that works in a moment. But what's unique about Kermit is we only get paid if we save the hospital money. So it's all gain share. There's no risk for the hospitals. And we've been doing that now for 13 years. We were the pioneers in that area. There were no competitors at the time. Now we have quite a few.
Wow. So in the worry, what is a real problem that you solve? What is the problem exist in hospitals that they didn't have a handle on, that you came in and you started solving? What is a real problem we're trying to get a handle on, Rich?
Yeah. So hospital supply chain is probably the area we spend the most time. These people are building contracts to buy things that they need to use in the hospital. And, the issue that we have in supply chain is hospitals are using many, many different types of service, everything from, landscape and lawn care and linen and food service to highly technical things like MRI machines, CT machines, and even these implants that we're talking about. And if you think about it, the person who is making those buying decisions can't possibly be an expert in every one of those categories. So they really need to lean on third parties who can help educate them about the different nuances and the different features of some of these products and why certain things might cost more or why they might be overpaying for certain things. They just don't know it. And so we come in and help a hospital understand that because my two co-founders were actually medical device reps, salespeople that sell implants to the hospitals for 10 years. And they stood next to the surgeons tendering devices into the sterile field as the surgeon needs them, and they get implanted into the body. And what's crazy about the category that we're in, Gurmeet, is that all of that utilization gets tallied on a piece of paper. So a barcode sticker is taken off the implant box. It's affixed to a piece of paper. The sales rep who's standing in the operating room with a surgeon, not providing any patient care, they're just selling devices, takes a pen and writes down what they want to charge for that item. It's all paper-based. Wow. So in addition to knowing what the price points are and who might be paying more for a certain item versus what they really could get on the street, so to speak, what's the real going rate, we also then take that paper out of the equation and digitize all of that through our software, so that when the bill is itemized inside of a mobile app and they hit send, that goes into the hospital system and we tell them what's okay to pay and what isn't.
That is very interesting. So how do the decision get? Because that process seems to be very manual process. What they've been using, Rich, is that you made one decision this way. Next time you don't know why you made that decision because you don't have the data to cover that, right? So it looks like there's no standardization. There's no customer. It's a humans making decision with not a very understanding a medical side or personal side. It's just a bunch of salespeople making decisions, right?
Right. Well, I mean, you can think of it this way. The real decision maker in any surgery is going to be the surgeon. He's picking out or she's picking out the best implant that's going to produce the best outcome for that patient. They don't want the patient to have pain afterwards. They don't want them to take a long time in rehabilitation. They want the best experience. And sometimes, not always, but many times, that is at the expense of whatever the cost is. So the surgeon really doesn't care. They're not incentivized to keep that cost low. They want the best outcome for the patient. So that's the healthcare side of taking care of the patient. Hospitals, as you can imagine, are a big business. A lot of cash flowing through in and out every single day. And so you've got the business people, the staff who are taking care of the finances of the hospital. And sure, they want the best outcome for the patient, but they also don't want to overpay. And so you have these two worlds that have coexisted for a long time, but they never really mesh or cross-pollinate until really, I would say COVID, and everybody became supply chain aware. You were hearing a lot of stuff on the news about supply chains are in desperate situations because of COVID and all of that. And the hospital was no exception. So now we have a greater focus today in the area of supply chain. It for a long time in hospitals has been an area that has been, if you were a supply chain officer, you were in the basement under fluorescent lights. No windows. Now it's kind of a white collar job. It's a C-suite job, has a lot more credibility and awareness. And I think that's been a real good thing. But a lot of the best practices you would find in any other supply chain in other industries are now just being adopted inside of hospitals, including use of technology. Hospitals have notoriously been slow adopters of technology, and rightfully so. I mean, their forte is taking care of patients.
Yeah. Well, every time we talk about technology or any process, Rich, one item is always there is a training and knowledge, right? So, vendors can put more features into the technology to MRI machines, all this stuff. So surgeons have to make a decisions. People around them how do these people get that they get trained on the new features, that new advancements become in a technology? How does that knowledge base or training portion gets handled in the whole process?
Well, I mean, you've got really two areas of that knowledge transfer. You certainly have the people who support the surgery who are in the operating room. There are a number of players who support the surgeon. You've got nurses in there. You've got people who are technicians who might handle the implants. And you've got people assisting in surgery. And that, I think, is for the most part is medical. For a long time, we've had this big push in the area that I'm in to get rid of the salesperson who is standing in the operating room with the surgeon. If they're taking advantage for whatever reason and they're raising the cost, let's just get rid of that person. Well, if you think about it, it's a virtual impossibility to train the nurse on every device that's out there. You've got multiple manufacturers. You've got differences between two products that they do the same thing, but they're different in their features and why one would be recommended over another. So this salesperson for the implant company is actually playing a vital and important role, mostly to the surgeon. They are the surgeon's safety net. Now, on the technology side, that's been fascinating because hospitals were forced to adopt technology. The federal government in the United States mandated, this is back, I think, when President Bush was in office, the use of electronic medical records. And in order to get from the paper realm to the electronic realm, the federal government subsidized or underwrote that transition. So they gave hospitals money to adopt the technology by a certain period of time. And by that deadline, that due date, everybody had to be on electronic medical records to take the place of the paper record. Now, you would think that would be a good thing, having electronic medical records, but it opened a whole can of worms, basically, of other things that people weren't thinking about, like my medical record is on one piece of software at the big university hospital, but let's say I travel to Hawaii and I break my leg. and I go in the hospital there, they don't have any way of accessing my medical record. There's no standardization, and there was no interoperability between competing technology systems. So that was a big spotlight. And so, what you've had in the training part of what you're asking is healthcare really catching up to where other industries are, who are more mature in the adoption of technology. They're really just starting to realize all these different things. And, a hospital, for the most part, is not a software development firm. They shouldn't be producing their own solutions, and they shouldn't be beholden to keeping those up to date. Their patient care is their mainstay. And so it's been very challenging in hospitals to try to adopt some of this technology. A lot of them come with very large price tags. And they're big integrations over multiple sites and enterprise systems. So it can be very complex.
But your solution, though, it feeds the data where the data is required. It provides automation, provides standardization, and helps people make a decision. So, what are some of the challenges you up against? For me, the way I'm looking from technology standpoint, Rich, it's no brainer. Something's gonna automate your process. They're gonna give you the data where you need to make a decision, and it's gonna feed all your systems. It's gonna simplify your process. It's no brainer. You have to simplify your process. You have to go on that path. So, what are some of the challenges you see in a market?
Well, for us, it's been really twofold. The first has been what I would call integrations or potential integration points between the data that we're collecting and other hospital systems that need to have that data or benefit from having that data, such as we talked about electronic medical records, purchasing systems like enterprise resource planning systems, ERP. It'd be great if we could integrate and push all that data into the systems. When we first launched Kermit, this was 13 years ago, we saw two paths we could go down. We could either be, inside behind the firewall, so to speak, and starting with an integration, or we could just be standalone in the cloud. And we decided to go cloud for the main reason that we could get up and running very quickly if we could build a system that was self-contained. It didn't need any other integrations. Now, would it benefit from being integrated? Certainly. But to do what we do, to be able to collect the bill, adjudicate the bill, tell the hospital what's okay to pay and what isn't, and provide very robust dashboard style reporting so people could see what are some other areas that they could actually optimize. That's all cloud-based. So we decided to go that route because what we were seeing in hospitals was a bottleneck for most technologies who are behind the firewall. You would have to sell first to supply chain, then you'd have to go through all the security assessment in IT. Then you'd have to get on the IT schedule to be part of the project plan for the integrations. You could be in a backlog be behind many other companies. And so we decided to go cloud-based. Now, that was great for initial adoption. We had some very quick wins with some very, very large savings amounts, some really good results. But after a few years of using the data, the hospitals would say, your data is very, very clean, and we're facing over here some discrepancies. Can't we just reconcile the two? And so now they're asking us to do the integration. So we're finding ourselves doing more and more of those after the fact. And so that's been difficult. The other thing that's been very difficult is more of a cultural fit. I will just put it that way, between the dramatic savings results that we can have when somebody deploys our services and software. For example, on average, we can save a hospital 30% of what they're spending annually in any one of these categories. It's not uncommon, Gurmeet, for a hospital to be spending, say, $100 million on knee, hip, and shoulder surgery per year, and for us to come in and whack that by 30%. That's bottom line.
That's big cost.
Yeah, it's going directly to the bottom line. So somebody like a CFO loves that. Right? All of a sudden, we're balancing their budgets through an area they weren't sure that they had any optimization in. But there are a number of players in the hospital who may not want us to be exposing what's really going on. Anybody from a supply chain manager who is paid and is expected to negotiate the best contracts. And like I said, they're purchasing so many different things that it's virtually impossible for them to be an expert in this category. To, let's say, a surgeon who has a preference toward a specific type of implant that might be a premium price versus something else they could use that's a better price but has the same outcome for the patient. So we have this interesting need of having to have a cultural fit between the people we sell to and the people that use our services and our third party coming in and being the expert in this category, and then willing to relinquish control in that category so that we can help them. I want to make them the star. I don't want to put the spotlight on anybody and say, you're not doing your job. But not everybody gets that from the get-go. I'll have, a no or two, and I'll say, that's okay. It's not for you today, but let's move out of the way so I can get to the guy behind you who wants to do this right now.
But what are you doing, Rich, is you're changing the business process. And as you know, every time we change a business process, for better or for worse, you impacting rules and responsibilities. You're impacting the way they've been doing things for so long. And a change is always hard, right? So, I think that the cultural side of what you just talked about is every time you introduce change through technology, even if for benefit or cost saving, it's going to be difficult. And as a human nature that to adopt the change, right? So you're going to get some resistance back from them. Sure. Are you also impacting the way they have a headcounts in each department, or they may have to allocate some headcounts here and there? Is that it comes to the HR side as well?
Typically not, because this category is not anything where you have a dedicated person standing around doing this job all year long or every day. It typically is something that you delegate to, say, a manager, a contracts person, or somebody. And in addition to this category, they might be doing contracts for other areas as well. So this typically comes up on the radar of a hospital maybe once a year, once every 2 years, they have to renegotiate these contracts. Now that person has to become an expert in everything that was launched over the previous year that they didn't see last time they negotiated. So that can be daunting. So there are customers of ours, for example, we still have a relationship 13 years later with our very first customer. Wow. And that's fun to be able to report, because, they got it. They wanted our help. They needed our help. We had a very good result. And so for the last 13 years, they've come back to us about 6 or 7 times to renegotiate those contracts. Now you can imagine the first time we go in, there's a lot of gain for us. We can push that price down from where the hospital negotiated it down to the street. But 2 years later, how much gain can I really get? It's going to be incremental. As new things are released, we're bringing that to the fore, and we're renegotiating some of those brand new products that got released. But we're also bringing in compliance rules, contracting rules, things that are in the contract that are very unstructured. They're hard to measure, but you have to have a piece of software that can collect all of these different data points and be able to enforce that contract. So it's a maturity curve. Somebody who's been with us for a long time will get that. It doesn't all come at once. That's probably the biggest change we can make over a long period of time for a hospital when they're with us for a while.
I see. So you mentioned about the maturity side. So business process that you introduce for the software has to mature over time. I think that's what you're referring to. So that business logic and the process you guys built into the software, does that work with all the hospitals? Do they have to customize some of the software or some of the features, functions in order to accommodate their business process, what they're currently running? How does that work? Can they simply just take on and run with it, or they have to customize a lot?
Mm-hmm. So this is kind of when I mentioned that, our approach was to go cloud-based. It was this way to get into the hospital very easily, very quickly, and unobtrusively. So how can we kind of come alongside even a broken process that's being used at a hospital and dovetail our software into that very quickly, and then over a period of time correct that so that they can become more efficient, rather than come at them on day one like a consultant might with here's all your results in a big tomb of paper, and you need to implement all this, and their head is spinning like it's going to take us years to do it. So that's what we did. We built this really flexible approach so we can come alongside a hospital, integrate very quickly, even to a broken system. And over a period of time, we can modernize that. That does mean that there has to be a high level of customizing of the software. But what we've done is we built a base layer that works for everybody. And then what gets added on top, really what we're doing is we're taking other contracts and using experts to read those contracts and program the business rules that are in those contracts into the software. Now, 13 years later, I don't know how many, 500, 800 business rules we've already programmed. We've already seen most of it. Most of it's now in the library. It's off the shelf. It's a matter of just clicking it on or off. But occasionally we'll find somebody who's very creative who will have to create a custom business rule. And the way that we built the software, it's very, very easy for us to do that. So we build that, we test it, and we deploy it. And that becomes part of the greater library for all of our future customers to either use and adopt in their future contracts, or if we see a customer that has that, and we can just turn that on.
Got it. So, and how's the training piece handled, Rich, on your side? I know even your sales process looks like you got to train people before you can sell. You can educate a lot, right? So, we are in a similar business as well. Before we can even sell something, we have to educate the market a lot. We have to train them. We have to give them information. And then when you do deploy a solution, you have to train everybody around the whoever's using it. How does that path get handled?
So in the very, very early days of doing this, the founders were doing everything,
Okay.
washing the dishes and cashing the checks and everything, and even programming the software. Now we're a mature company between 25 and 30 employees, fairly well staffed. And so like a more mature company would do on the sales side, you've got salespeople who are doing the prospecting and the presentations. And then in this technical area, they'll bring in an engineer, so to speak, and we'll come in and say, okay, I'll put this together with your IT people and we'll show them how it's going to work. And that's a sales role too. Even though they are programmers, they're adept at being in the room and being able to explain in layman's terms how this is all going to work, how the project plan is going to lay out, and just overall giving the hospital a level of comfort that we're going to take care of everything for them. They really don't need to do anything, but they're going to have total visibility to the process to slow something down, speed something up, or just have oversight during the whole process. And so, yeah, it's salesperson, sales engineer, and that kind of a realm, which is pretty typical in technology.
Yeah. Well, that makes everybody's life much easier. Once you can, have knowing that there's a support around you, whatever the decision you're making, there's enough education, enough information, people feel comfortable going, taking the next step and moving forward with this stuff.
Right, for sure.
So let's talk about your journey. What got you involved in this role or Kermit, and what have you been doing before it?
So Kermit is my fifth startup, meaning just hey, if there's a need that can be solved, how do we create a business around that? And so that's kind of where I've thrived and lived for probably a good 30 years of my professional career. I have been on the other side of the paycheck. I've been an employee for a couple of different firms, and that's always good too. I think you can kind of hone your chops on somebody else's dime, so to speak, and go to conferences and have them back you, and you can learn. And so I started really as a marketing graduate from San Diego State in California, where I was born and raised and lived at the time, and came out and started doing selling real estate appraisals of all things for a company that was an appraisal company. And so my customers were mortgage brokers, and they needed appraisals done. And I was the go-between, the customer service person, in other words, to get that appraisal done, booked, sent back to them in an efficient way, and bill them for that. And it was an interesting first job, very sales oriented. I'll tell you a funny story. They had a sales contest in the organization, and this is back. I'll tell you because this is really important. I'll date myself. This is back in the late '80s, early '90s, and they said, "Here, the prize for the sales contest." There were 5 of us selling at the time. Was you can either have a cell phone installed in your car, and those were the kind that didn't leave the car back then, right? For your younger viewers, like we used to have cell phones that were bolted into the car, and you had to leave them there, or a Rolex watch. And it was a 2-month sales contest. I won the sales contest, and I said cell phone, right, all the way. So no, the Rolex would have been a much better investment looking back on it now. But I had one of those squiggly antennas on my car, and it was a status symbol for a while. But
they used to be a couple of pounds. They used to be heavier phones too, right?
Yeah, and there was a kind you could actually unclip from the trunk, put it together with the handset, and hang it on your shoulder.
Okay.
Yeah, crazy, right? So, but that was my first job out of college. What I realized during that was really in selling how to service a marketplace and how to delight a customer and keep them coming back, and how to differentiate. If you have nothing else to differentiate it on, your price is already low, but there's a very competitive market. How can you beat your competitor? And a lot of it was just understanding service and how to delight people. As things would happen, that particular business went bankrupt. It was a great business, but the 2 owners were actually focused on becoming landlords and invested in a bunch of properties in Southern California. And that kind of got ahead of them. And so they shut the doors. But I had all of these customers, And I had a bunch of appraisers who were out of business. And I said, you know what? Why don't I just start a business? I went to my dad, who was a cardiologist, and I said, look, what do you think about this? And he goes, you should probably just get your resume together and go find a job. And I'm like, that's not the answer I was hoping for. I wanted some encouragement to like, sure, start your own business, see what comes of it. And I had this feeling that if I didn't try it, I would kind of be kicking myself forever about what could have been. So about a week later, I kind of got the appraisers back and went to my customers and said, look, I have an entity. You can keep ordering. And I've got all the same appraisers. And I started a real estate appraisal company, which very quickly grew to about 15 people. And nice. I realized that I was actually giving the appraisers the lion's share of the money we were making for the jobs they were doing. And I was only keeping a small percentage. So I went out and got licensed to do real estate appraisals and kind of joined the fray. So got rid of most of the appraisers, did all the work on my own, feed out the work that I was too busy for. And then came the big savings and loan bailout. And we found ourselves on the other side of that, and I had to close that business. But what it did give me was a little bit of insight into not just the specialty of appraising, but everything else you need to understand to run a business: marketing, sales, finance, lending and borrowing, and paying people and payroll and all that kind of stuff. And I thought, that was pretty cool. I liked the freedom of that. I had some extra cash. I went out and bought myself a boat. And so on Fridays, I just shut the office and take the employees out, and we kind of go bar hopping on the boat. We do things like that. And I was very young at the time, but it did give me an idea of like what entrepreneurism could provide you as a lifestyle. And, since then have started and sold a couple of businesses and dabbled in a few different things.
Wow, very interesting. And, it's once you get a hang of it, what it takes, how much hard work you get, and one thing you control is how much hard work you want to put in and what's the outcome you want in an entrepreneurial business, right? I think that's a part I kind of enjoy, that, it's all up to you how hard you want to work and what are you looking for as a reward.
Right. Absolutely. I think there's a balance between the type of business you want to have, and you want a lifestyle business, something that just puts money in your pocket and you can afford to do the things that you want to do and gives you that freedom. Great. And I did that, and that was fun to experience, and it benefited my family. But as I got older, I really wanted to start a business that would leave a legacy and fundamentally change the way that certain things were done. And that's the opportunity I have with Kermit. Things were being done this way before we showed up for 20, 30, 40 years.
Yeah.
And so even if we just made a small impact and changed something before we handed the reins over to a larger company who could take it all the way, that would be a win for me. And so I told my co-founders when we first started, if you want a lifestyle business, I'm not your CEO, but if you want to leave a legacy, we want to grow this thing and sell it to somebody bigger who could make it something really, really big, then let's do it. And so we all kind of put our hands in and said, that's the kind of business we want to make.
Well, one, you're making an impact on a lot of lives, a lot of people around you, and especially hospital staff, making the life easier. I think the second part of that is you eliminate a lot of errors that could be made with a manual process, right? So how many best decisions that you're saving for not for hospital for patients as well, right? So I think that itself is not as small, it's a much bigger impact that you guys probably thought it through.
Yeah, and you raise a good point, because that is the culture that we espouse inside of Kermit. We have a number of people who are working with us, side by side with us as employees now, who came from the hospital, who came from different areas, and they felt like, I want to make an impact, but I feel like I'm spinning my wheels being in this big machine here. Nobody knows me, or nobody hears me, or the benefit of what I'm doing is not being seen. And they like the idea of joining a small organization where when they make a change, there's a big impact. It's rewarded by the founders, but it's also seen by the clients and appreciated by the clients. And we've really built a culture around that where people are getting a lot of satisfaction from doing good things like that because they get immediate feedback.
Yeah, because you're making so much, hospitals, in my understanding, I never worked in a hospital, but my understanding is very stressful environment.
Yeah.
Right. Because you're dealing with a lot of human challenges. And the room to make a bad decision is higher, right? So when you're making a manual decision, there's a lot of room to make a bad decision. When you're introducing something automation, something data-driven decisions, you're taking the errors out. I think that's a big win for patients and for hospital staff and for you guys. I think that's a huge impact on those people.
Yeah, I would agree.
Very interesting. Definitely, I deal with a lot of business owners as well, Rich. One thing I'm hoping that the business process, the way you make an impact. A lot of business leaders, they have to make change their business, especially after COVID. They have to some people, they have to just reinvent their product or reinvent their services. They have to make a big changes in their business to scale up the company, scale up the businesses, and sometimes the change could be hard. What you just outlined, yeah, there's a lot of benefits, but you have to take on a change. Staying status quo is just not an option for a lot of businesses, right? So a lot of business who's trying to make a big changes, they gotta take on all the benefits. They gotta change the process. Any words of wisdom for them? Like you've been doing that for a long time. Anything you learned that this make it a little bit easier for these folks?
This is a question that I get fairly common. It happens a lot. I would say it's not that I want to give advice, because that's not really who I am. I will tell you this: staying flexible, having maybe a little bit of reserve of cash on hand was a big help to us. Letting your employees know that while you may not have the answers today, you're gonna figure it out. You're out there fighting for them first, and everything's going to be figured out. I think the biggest thing back in that time, if you rewind a little bit to where your mindset was when that was all starting, COVID, was we don't know what's coming next. And that uncertainty, especially if you're not the person in control, is very unsettling. And so I realized that with our staff. We said, in the area that we were in, we're watching, I think it's early March. We're starting to get rumblings that maybe this is a real thing. And then second week of March, things are closing down. And then we're thinking, certainly hospitals are not going to shut their doors. They're ground zero for helping people through this event. They're going to remain open. Second week of March, they closed their operating rooms for the most part because they weren't doing elective surgery. They were, you remember, they were setting up tents in parking lots to receive patients, and nobody knew it was going to happen. So, I looked at my co-founders, my senior executive team, my managers, and I just said, we can't just sit here and let this happen. We've got to make some decisions right now. And the first thing we need to do is make sure that the staff knows they're taken care of. I remember walking into the office during that second or third week, and we had a brand new employee who had just joined us about 3 weeks earlier, and he had a box on his desk and he was packing his stuff up. And I said, what are you doing? He goes, well, it's obvious. I was the last to be hired. I'm definitely the first to go. And I said, nobody's going anywhere. And that moment made me realize I had to kind of get out in front of the company and tell them as a group, number one, nobody's going anywhere. We're committed to keeping all of you. Number two, I'm sure there's going to be some kind of assistance program. And when something is released, and it did, the PPP loans came around, I said, we will be in line. It will be one of the first to apply, and we'll get whatever assistance we can. But number three, we've been very frugal and smart with our spending. We have some money saved up in the company. And if we don't have to get rid of anybody, we won't. We don't want to let anybody go. And I'm proud to say, Gurmeet, we weathered that storm all the way to the end without letting one person go. In fact, nobody left. Everybody thought that that was going to be a good place to work because we were taken care of. They didn't know what they were going to do for a living because operating rooms had closed. And the only way that we could actually send an invoice out to earn any fee was for a hospital to do surgery and save money. And they weren't doing surgery. So that went on for, a good 8 months before they opened again. So we were quite uncertain about where we were going to build a business. But everybody came in. It was kind of like that Apollo 13 movie or whatever it is, where they're in Houston trying to figure out how to get the astronauts home because there's been a failure. I mean, everybody was hands-on and said, what is it that we've built or created or owned that we could turn around and repurpose and make a business out of? And we started doing that because we weren't sure that the operating rooms would open again. So I think that leadership aspect isn't anything that you can learn. It's just about being at the level of where your employees are and caring for them and thinking about them like they want you to. It's no different than you would do for your own children, your family members, right? So that was a big lesson for me. And we came out on the other side doing okay. We still in healthcare are still recovering, if you could imagine, from that event. operating room volumes have not returned, and it's been now over a year, 2 years almost. So, and I think a lot of that was the people who are getting elective surgery, if you think about it, could be in their 60s, 70s, 80s, and they just don't feel comfortable going back to what they saw on the news as ground zero, where people were coming out in white bags. They don't feel comfortable going back to that environment. So I can understand that.
Yeah, business leaders, they always have to make some decisions, right? So, that's what we're there for, right? When you're making a decision, especially when you're on technology, you gotta, if you just stand behind your people, I think if you take care of people, everything else kind of falls into place, right? If you drive it, if you started from that angle.
Right.
So where is Kermit's going for next couple of years? What's the plan for, if you guys have any, what's a road ahead for success for you guys?
Well, I think for many technology companies and even other companies that aren't using technology, everybody's wrestling with this idea of artificial intelligence. And what does it mean? How does it impact my business? Do I just bury my head in the sand because I really don't understand it? We'll just see what happens. And, my thinking on this is I think if you don't understand it, you're going to get left behind. Now is the time to do your research and start to learn about it. And I think there are plenty of approachable ways of learning about AI. I mean, the way that I really got started was just watching a lot of YouTube videos of people who could kind of dumb it down for me and help me understand. And then, getting your feet wet with things like ChatGPT and trying things out. And you'll find a place in your business the more you play with these things to make it unique for you and solve a problem. So for us, a big part of it is adopting greater processes that AI can take care of so that we don't have to be manually entering information. You think about it, as I mentioned before, there's this paper-based bill, and the format of that paper could be different from one vendor to the next because the vendor is providing that format. So building AI to understand where the data elements are on that bill to read that has been a challenge. And we've made very, very good progress on that. And that's taken out a whole segment of our workflow, not just people, which we don't lay those people off. We redeploy them in more valuable ways inside the organization, but also to just speed everything up and deliver our services at a lower cost and pass it on to our customer base. So I think AI is going to be it's a big challenge, but it's a big opportunity for anybody who wants to get involved and understand it. I also think, and although the sexy financial part of this has kind of died off, the blockchain is still, cryptocurrency aside, still a big game changer. Smart contracts and things that are going on the blockchain can build the trust and automate the trust between what typically is two parties who are trying to look out for their own self-interest. Blockchain democratizes that. So I think that's another area that people have to take a step back and say, is there anything in my business that could really benefit from that? And learning that now and adapting and adopting it now, even in a small way, does it give me an advantage over my competitors? And I would say, yes, that blockchain is here to stay. And I don't think that a lot of companies have taken a step back to figure out, except for cryptocurrency companies, how it's really going to change things.
Yeah. I mean, AI is, I think every software company, these new algorithm, new way of analyzing data. It's always driven by software companies, right? So it's you in your industry, you guys are pioneer. How you understand the data, how you translate the data, how you manipulate the data to make some business decision. So definitely, I think that's probably the bigger part of any software development company over the next few years. That understanding AI, how to best use it. I see some CRMs. You can see that they already implemented AI quite a bit.
Right.
And simply, you simply just punch in a company and they give you all the data that a company exists on a social media. They will crawl that, all the data and help you make some decisions around it. Is the right in the company you're looking for, right? So it's already in a works in a software fields. I think that probably will help software developers to take the game to the next level.
I don't know if you saw this recently. I've been interested to get your opinion about this, but I was on LinkedIn the other day making a post, and I saw a brand new button that says, "Would you like to rewrite this with AI?"
Yeah.
So it's being pushed out into environments where sometimes we don't even know that it's working behind the scenes. Yeah. But I think that's an interesting application, that if you have a software like or a community like LinkedIn that has a very, very broad reach, the people will start to be exposed to how it really works. And they take that fear level down a notch and say, okay, I'm just going to click the button. I don't think it's going to do anything bad. And then you see the result comes back and you say, okay, I'm a pretty decent writer, but like that actually worked out really well. I'm going to go ahead and say, yeah, I'm going to post that. That's a really good example of how like something like ChatGPT can be deployed in a non-threatening way. And, there are APIs back to GPT now that we can all use in our everyday software. And you're going to start to see it come to Microsoft Office and different things like that. But it's already sitting inside of Google. Now, when you do a search, you can get the AI enhanced version of the search, or you can get your regular search results. So we're moving that way every day.
There's a lot of great applications when it comes to AI. There was a gentleman who written a couple of books on AI. It was on my podcast. We were talking about that, and one of the greatest applications I've seen for AI so far is as the guy sitting in India in a rural area where he has a own original language. He doesn't understand nationals, English or their Hindi national language. Mm-hmm. The bill comes to him in that language, and he has a device in front of him. He simply clicks a button and he translates for him, help him pay the bill, in his language, and explains every little fields to him, whatever he wants to move his fingers over, and he tells him, this is how much you're paying, that because of this, and hits a button and he pays the bill right away. So that's great applications from an AI standpoint.
That's fantastic. And it brings up this whole idea. There's probably going to be two camps that emerge. The people who are scared because it's going to replace that particular thing that they do really well. And those who understand, yes, that may happen, but it also can really enhance, that person was sitting there. They didn't need to hire a translator. They didn't hire a consultant to come by their side. They got a basic thing done, like paying a bill, and their day moved on. And they probably marvel at, like, where was this thing 10 years ago? This is going to be the way of the future. So, I was going to break us up into those that are afraid of it and those who embrace it. And I think those who embrace it and figure out how to make them be able to do things more efficiently, smarter, cheaper, faster are going to be the winners in all this for sure.
Well, let's see here. Listen, I learned so much from our discussion. Definitely, every time we talk about process and somebody trying to simplify process in a hospital, no matter what the sector is, I'm always looking forward to learning those process, how somebody else solve a problem, and learn from it, how could we solve a problem in a business as well. Mm-hmm. And I'm sure business leaders who are watching or listening to us, they probably took away something that they could solve their problem in a business as well. Whether they use a software like yours, or something else, but it just show you how important it is to take the manual process and put some solutions around it, and not only you can solve it once, but over and over, it'll give you the same result, and the same data what you're looking for to make the further decision. It makes everybody's life much easier in a longer run, right?
Yeah, that's right.
Good. Any words you want to leave for audience then Rich?
I would say if anybody's interested in this particular category, it's definitely going to be a niche for some of your listeners and viewers. But if they're interested in healthcare cost reduction, spend management, it's a big movement that needs to take place because unfortunately our healthcare system is broken. The cost overruns are dramatically more than we have in other countries. Is to check out what we're doing at KermitPPI.com, KermitPPI.com, and you'll have that listed in your notes, I'm sure. And then also follow us on LinkedIn. That's where we do a lot of our own podcasting up there. We publish a lot of stuff and studies and things, and people can figure out how to interact with us if they think that's interesting.
Yeah, no, I'll leave a link below this video as well for your website and also for your podcast as well. We in Canada in a similar boat. A lot of bad decisions are made, but in our case, the difference is people don't pay for it. The government pays for it, so we don't get to see that all the mistakes and all that stuff. Right. The errors are made, right? It's because it's just government paying for it. But still, the mistakes. You can also imagine that when people are making decisions, government's making sometimes more wrong decision than humans involved with the front, right? So
that's right.
Good. Hey, thank you so much for your time. I learned so much. Thank you so much for the discussion. We'll talk soon. Yeah.
Thanks, Gurmeet. Appreciate it.
All right. Take care.
All right.